your practice. I think we have Dr. Pozner, who's coming right now, and he's going to be discussing skin tightening. Can you hear us back there, Dr. Pozner?
Okay. Can you guys hear me?
Yes.
Okay. This is the Elman device. You can see this is actually started out as an electrosurgical unit, and some of the ENT guys know this very well. They use these devices for turbinates and other devices. You can also use it like a Bovie in your practice. So it's a very versatile machine to have in your practice. You can use this to take off lumps and bumps, so that if you have this device, it's great because you can use it for lots of different things. The main thing we use it for in our practice, though, is skin tightening. So let's kind of go through the class of this device. So you can see here it says bipolar, so that's what you'll use in surgery, bipolar radiofrequency. But these are all monopolar heads. So the patient is grounded, you can see, because it's monopolar radiofrequency, there's a grounding pad. And they have different size applicators that you can use. You can see all these different sizes. Okay, so what do you do with monopolar radiofrequency? Okay, you heat up skin. So this is, as Jeremy was talking about, and everyone was talking about earlier, and Hema also, you're talking about bulk heating. That's the goal of this procedure. Now the beauty of this device is I don't do this in my practice. Okay, we have one, but this is a delegatable procedure. This is a very safe device. And you'll find that when you get into practice, for those who are residents, you don't want to do everything in your practice. You don't want to sit there tightening up people's faces, because you could be in another room squirting Botox and fillers or really doing medical dermatology. So this device in our practice is performed by our esthetician, okay, who's excellent at this. So this is like the third time I've done this. I've done it on myself. I've done this at another seminar, and now I'm doing it on Alyssa. I want you to be very scared for this.
So the state-by-state guidelines are going to vary. It depends what state you're in, but in many states, radiofrequency devices and ultrasound and even IPL are delegatable, which means that they can be performed by non-physician staff within the office.
Right. And in Florida, this is a delegatable procedure. And, that's the beauty of these devices. When you see patients in your practice who need this, okay, we delegate them to the person who we think is safe to do this in our practice. And that's the beauty of this. So what you do first with this device is you're going to take some gel. This is just as a coupler. So we're going to put this on her periocular area to start with. And I have the lovely Jillian here who works with the company to help me, right? So this is Jillian. So Jillian's going to shoot a temperature reading. Okay, we'll take this. Okay, we have this very nice infrared thermometer that you can buy at any Home Depot. We buy these on Amazon, okay? We use these devices very frequently for all our radiofrequency devices in the practice. Because remember, whatever you're doing, you're heating up the skin. This is bulk heating. You're trying to create a collagen remodeling response. So Jillian's gonna do this while I treat the patient. The initial setting is at 15. You can see this nice little handpiece, which is 15 millimeters. As you press down, it activates. So it's a really simple handpiece. They really improve this. Ready, Alyssa? This is very, very simple.
Dr. Pozner, it looks like you're treating around the eye area. When would you use an eye shield?
Well, this is a radio frequency device, okay? So I don't use an eye shield for a radio frequency device. If it was a laser, I would definitely use an eye shield. So actually, you would probably not want to use a metal shield with these devices because they may, conduct some of the energy and may heat up the globe. So we don't want to use this. So I'm going to treat her periocular area. Watch what I'm doing. The protocol now is 5 passes with this particular device.
So this was a question that came up from the audience. The bottom line is when you're treating with radiofrequency, you'll notice that neither the patient nor the treating clinician needs to wear eye protection. Whereas if we're treating with IPL, for instance, or some of the lasers, we definitely need to.
Okay.
Dr. Pozner, how long do the results, this is a question from the audience, how long can you expect the results to last after using tightening in general, not specifically this device?
It's funny, I get this question every single day in my practice with everything that I do. How long does this thing last? How long does a breast augmentation last? How long does a radiofrequency last? And my answer is always the same. It's not like Cinderella. So at the stroke of midnight in 48 hours or 3 months, it's not going to go back to square zero. It doesn't work like that. These are collagen remodeling devices. So we're improving her collagen, and she's going to get a permanent result. It's going to improve her collagen. Now, she's still going to age. Now, if she continues her evil ways, goes in the sun, smokes, like does all this bad stuff for her, doesn't take her vitamins, she's going to age faster than if she takes care of her skin and uses a good skincare regimen. So everything is additive that we do. So this is how this device works. You can see it's very, very simple. The little light goes on. I have good contact. I'll take more questions as I keep treating her.
One thing that I explain to patients when they ask how long results last, and Dr. Pozner's right, this is a recurrent question. I tell them we're turning the clock back, but we cannot stop it ticking. However, they will always look better than if they had not had the treatment done, because of course, as we're stimulating collagen, those effects will be there even as the aging process proceeds.
And Dr. Pozner, one of the questions also that came up just in general with regards to skin tightening is what kind of topical anesthesia is required, for this device and for other types of skin tightening?
Nothing. Okay. We actually, as Jeremy said before, we want the feedback from the patient. We're trying to heat them to a certain temperature, which is somewhere about 42 degrees. We're trying to maintain that temperature. If you use a topical anesthetic with the patients, what will happen is you'll get rid of that feedback system. You can overheat them. So we don't use a topical anesthetic for any of the radiofrequency things that we do in our office. And again, the whole concept of this is bulk heating. It's temperature times time. We're trying to get her temperature up to a certain amount, let's say 42 degrees, and we're trying to maintain it for a while, and that's why there's multiple passes. And you can see this is the same principle that we're using for any of the other radio frequency devices in our practice. But again, this is a very nice little small unit. It's very cost effective in your practice, and any of these devices are not home runs. You don't expect to buy this device and make $1 zillion. What you expect to do is get this device, have your esthetician or anyone in your practice treat it, and it'll pay for itself over a few month period, and after that everything is profit. Very little disposable costs. You really need to look at that when you evaluate devices in your practice. Disposable costs are killer down the road. So this is again a very cost-effective device. People like it, our patients like it, and again it's another thing we use that gets excellent results.
Can you overlap these passes? It looks like you're doing a little bit of overlapping. It's not dangerous.
We're trying to overlap. Because remember, this is low energy. This is a low energy heating. So you're overlapping and doing these 5 passes because I want this energy level and I want the heat to get up to a certain amount. Really, any tips? Am I doing anything wrong? It's much quicker than this. Again, my esthetician just goes through these all day long.
What would you recommend for pore size? That's a common complaint in practice, and patients want their pores to disappear. Which of these devices would actually be good for that?
That's a tough question. You're probably getting better on topicals. You may get some pore changes with any of these devices, but you're probably better off with, talking about light chemical peels. There was actually an interesting study done with Alimera. It's a new low-level ALA. We were involved in their study, and they've been actually showing some reduction in pore sizes. Think bulk heating, think tightening. Think younger patients get better results than older patients. Non-smokers get better results than smokers. And interestingly, I always say the people who need these devices the most get the worst results. So if you start with this young, beautiful patient, she will get great results with this, and she will actually maintain her beauty. If you take someone who looks like a disaster, this is probably not going to help them for a while.
One thing just to point out, our AV staff just notified us they will not make this louder noise in the office. This is just because it's being picked up by the microphones backstage, which are very, very close.
There's some feedback. Okay, I'm going to treat the upper lids too, if you can see this now.
How frequently can you repeat this treatment? What's the ideal kind of wait time between treatments?
Okay. The protocol for this device is every 3 weeks. And it's interesting, most of the devices we use, it's kind of 3 weeks, 4 weeks, 5 weeks in the practice for repeat. The nice thing is because it's radio frequency, again, you can treat the upper eyelids with this. It doesn't affect the hair. So there's very few devices that you can use very safely on the upper eyelid. Hot? Good. Any more questions on this device?
The spot size is also very small, which is amenable to use
Yes.
around the eye. Yes,
Right,
question?
and they actually have different spot sizes. You can see the smaller spot sizes. So if you're really trying to get in on one little area, you use a very smaller spot size. Okay.
Oh, one of the questions was what kind of gel are you using? Is this just a clear ultrasound
This is
thermocoupling? Is it KY or what are you using?
Helivate treatment gel. Okay, which is basically just a simple gel. But when you're dealing with any of the gels in your practice, be careful. Mostly use the clear ones. Some of them are tinted, and some of the lasers will pick up some of the tint. So be careful that radio frequency doesn't matter. It's colorblind. But if you're using lasers, careful to use clear gel. Okay, 1 minute.